This is the 16th of 16 regional forums that have been held all around the province. The response from my perspective as a health minister has been quite remarkable to the conversation on health. To date, we have had now, with this being the 16th forum, there have been over 3,000 people who have participated in either the regional forums, the professional forums, or the patient forums, and I think that's remarkable. And several thousand more indicated an interest, and we had to keep the numbers down to around 100 for each of the regional forums, but many more have expressed an interest in being part of it as well.
So, David Black, you are attending this last conference of the conversation on health. What specifically you think is wrong with our health care system?
I don't think our healthcare system has kept up with the changes in our society. We've had an aging society. We've had people getting older, and we've seen our public health infrastructure, our hospitals and so on, not keeping up with the times. Our system hasn't kept up with the needs for home care, the need for a pharmacare program, and things like that. And I think there are some ways we can move forward and make our public health system better.
Okay, is that money because the budget has not been increasing, or why is that it has not been kept up, as you say?
I think it's two things. I think part of it is money, as we've had tax cuts and we've seen budget surpluses. Healthcare hasn't kept up with the growing economy. But at the same time, I think we need to see different ideas in our healthcare system. We can't do things the way that we've always done it. We need to do things differently.
One example of an idea that should be different.
I think a home care program and looking after people in their homes rather than necessarily sending them to hospital, especially elderly people. If we can provide the supports for them in the community, that will free up hospital beds for people who truly need them.
And you think that's what you're going to be discussing today in this conference?
I hope so. That's what I've come here to talk about.
Okay, good luck. Thank you very much.
Thank you.
All right. I spent last evening watching the new Michael Moore movie, Sickle, which was kind of interesting. And I thought, I suppose we all have our different views perhaps on Michael Moore and the editorial balance that he brings to his presentations, but nevertheless, I think it was, for me at least, a very forceful reminder of the quite exceptional health care that we enjoy on a universal and comprehensive basis in British Columbia versus the situation for some in the country of the United States. So it was interesting.
Your name is Penny
Tilby. Penny Tilby.
Penny Tilby. Okay, and you think there's something wrong with our healthcare system?
I think there's a lot that could be done to improve our healthcare system, but I'm really quite unhappy about the suggestions that have been made by the provincial government about the ways to fix it, and that's why I'm here.
Specifically, what is one of those things that you're not happy with?
Well, the way they framed the problem, they say that we don't have the resources to sustain our public healthcare system, and I think they've been misusing statistics to make that case. And I think it's really because there's a drive to introduce more private medicine. We've already got beginnings of that. I'm very concerned about that. I want to keep our system public. I think it costs more, all the efforts that they make, bringing in private clinics and so on. And ultimately it shifts the costs from the public sort of sphere and tax-funded healthcare to individuals, and we'll end up with a user-pay system.
Mm-hmm. You hope that after today the government will listen to the citizens and make some changes?
Well, one always hopes. That's why I'm here, is because I think one needs to be part of the process. If the government has said they want input, then I hope they're going to take very seriously what they've been hearing from people all around the province. I've heard from others that there have been a lot of feedback that people don't want to move to a dual system or a two-tier system. And so I'm hopeful that that message will get through.
Is the system in British Columbia one that needs improvement and is open to improvement? Absolutely. I think there's probably hundreds of ways that we can improve the healthcare delivery system in British Columbia, and that's part of the deal here. And the conversation on health is advising us of where you think, from your perspective, we might be able to improve health outcomes for British Columbians. So when you look at those health outcomes, again, I think it underlines that, at least in a relative sense, we are doing well in British Columbia. British Columbians live pretty much longer than anybody else on the face of the earth, and that's a good thing. I enjoy living. I'd like to live as long as I can. And so British Columbia's men are now the longest living men on earth. We have recently eclipsed Japanese men as the longest living on the face of the earth at 80 years. So that's a wonderful thing. Apparently that relates to Japanese men smoking more than British Columbia's men. And so we have moved past them. So that's a great thing. British Columbia's women still live about 4.5 years longer than British Columbia's men, and I think that's sensible as well. Still a relative sense of peace during those latter years, and I'm sure welcomed by all parties in that respect.
So this is Seth Klein from the Center for Policy Alternatives, and you've been selected as one of the people in the conversation. What do you expect is going to happen here today?
Well, I'm a sucker for a good conversation about policy, and I think the dominant message out here, I suspect, would be no different from the other 15 public forums that have already happened, which is a strong statement in support of public health care. You know, I think a lot of good stuff will come out of the conversations from the public. I think the bigger questions are, you know, what kinds of preconceived conclusions did the government bring from the outset, and will they really hear what comes out of the conversations? But I'm expecting the conversations today themselves to be pretty good.
What is one thing that you would like to see change in the healthcare system?
Well, I think there are definitely problems and things that need fixing, and there are all kinds of solutions available within the auspices of the public system that can be done to improve it. In particular, an expansion of community health care, whether it's long-term care, home support, home care, community mental health services, 24-hour primary health care centers. All of those would take huge pressure off the more expensive acute care system and would be of great assistance. There's all kinds of innovative solutions that can be done to reduce surgical wait lists. We've documented those things within the public system.
Who should start those community clinics with all those services?
Well, I think the model is there with community clinics like Reach on Commercial Drive in mid-Maine, that you have multidisciplinary teams of doctors, other healthcare professionals, community outreach people, prevention people, working in community clinics, but that are run as non-profits with community boards.
So if the need is there, why aren't they expanding?
Well, that is the question with all of these things. The pilots are there, whether it's innovative means of reducing surgical wait lists or innovative primary health care centers. And the big question is, why aren't they being scaled up? And why are we considering these other so-called solutions instead of scaling these up? And that's what I'm going to be bringing today.
Do you think it's just money, or is there lack of interest on general population, like doctors and nurses that don't want to work for those clinics?
Well, I think there's a little bit of resistance from the doctors on some of these things in terms of taking away their autonomy, although I think sometimes that gets overstated. I mean, lots of doctors would welcome being on salary instead of on these fee-for-service schedules. So it's sometimes it's baffling why we don't see more of this.
On the other hand, on an aggregated basis, if we look society-wide or province-wide, it is a fact that as we get into our 80s and 90s, our healthcare costs tend to be, on an aggregated basis, about 10 times those of people in their 20s and 30s, and that's to be expected. And it's a positive thing that we are living so long. But there are some costs that are going to come with that, and we have to be realistic about those. So that's a challenge. So we also have, more than ever before, more and fancier diagnostic equipment. Every day we hear about some new pharmaceutical that's going to allegedly help us enormously, and sometimes they do. So that's important. But all of this comes at a cost, as you might imagine.
Your name is Robin Prest, and you are been selected to be in this conversation today. Do you think that the healthcare system needs something to be fixed?
Well, I definitely think that there's always more efficiencies that can be found. I'm a little bit skeptical about the crisis sort of language that's being used around the conversation, simply because if you look at healthcare, how it's funded, as a percentage of provincial GDP, the costs haven't really gone up significantly. As a percentage of provincial revenues, the provincial government's revenues, costs certainly have gone up, but that's partially because there's been major tax cuts, so provincial revenues have gone down. It's also partially because things have been taken off the provincial books. BC Ferries is now its own private entity. So I'm very interested to see how things are framed today and whether or not they're framed in a way that uses statistics to gear towards a certain outcome, or whether or not that they're unbiased so that people can draw whatever conclusion they like.
And that outcome, you think, is the expansion of privatizing the healthcare system?
Well, the provincial government has certainly shown a interest in that direction. From the Premier's tour of Europe earlier, looking at private systems, mixes of private and public systems. You certainly get the impression that they're headed in that direction. Whether or not this conversation will provide a grassroots ability for citizens to give their opinion on that, or whether it'll just be a public relations exercise, hopefully we'll find that out, and I hope for the best.
We'll see if they listen what you have to say.
We will.
Thank you very much, Robin.
Thank you.
You have a $13.1 billion operational budget to work with. You have a $700 million capital budget to work with. And while that is a staggering amount of money, almost $14 billion, you will be surprised how quickly it can slip away. Because one of the complaints I don't hear ever is that we have too much money in the healthcare system. That is one complaint I have never heard, and actually I don't expect to hear it. So it's a challenge, and this ticker reminds us of just how quickly money moves on in the healthcare system. $1.5 million an hour, $36 million a day, and that's a challenge. Again, a lot of money, but a lot of demands. You have to think about things like emergency rooms and acute care hospitals. You have to think about residential care and assisted living, home care, mental health and addictions, very important part of the healthcare delivery.
Why is the counting of the economics important in healthcare? When I break a leg, I don't really care how much it costs.
Well, I know from a patient perspective, the cost may not matter. When one is working with a budget and we need to deliver a broad range of services within a particular budget, then the costs are important. Any time that we can either reduce or avoid costs, those are dollars that we can devote to more patient care, because there's always a demand for more patient care.
Isn't the expense of healthcare going to the healthcare workers? Therefore, it doesn't matter really how much it costs, because that's just an income for the doctors and the nurses and the hospital workers. So why is it important? The budget, what's the budget have to do with my health?
So a portion of the provincial budget for healthcare is for healthcare professionals. There's no question about that. I suspect it's probably around 70% of the cost of provincial healthcare is for the medical professionals that provide the care, and that's fine and appropriate. That is not an area where one can generally try to reduce costs. For those medical professionals, they are under contract with the government, and we pay them for their services. Where there are opportunities to avoid costs are in areas like procurement, when we buy literally hundreds of millions or perhaps billions of dollars for supplies to operate the healthcare system. If we buy that on a pan-provincial basis, sometimes we can secure savings for the system, and again, when we secure those savings, we can pass them on to more and better patient care.
I know one idea that's surfaced in these hearings is putting doctors on salaries. What do you think of that?
Well, I think in some cases that actually works out very well, and what we're finding, I think, increasingly in British Columbia is an interest on the part of medical professionals, particularly doctors, on being on salary. So we've seen quite a number of emergency room physicians moving from a fee-for-service model to a salaried model. That works well. As we have a growing primary care sector sector that is community-based, collaborative care in now I think probably a couple of dozen community health centers. Those doctors are all on salary as well, and we're finding more and more interest in that. So I think in some ways it works well, but there's certainly an important role for fee-for-service physicians, of which the great majority of our 9,000 physicians are fee-for-service. They'll remain such, I'm sure, because that is a very useful part of healthcare delivery as well. So thank you all very much.